Hello, my friends. A very good afternoon to you all. I'm Dr. Firuza Parikh, and I'm the director of the Well Women Center at the Sir H.N. Reliance Foundation Hospital. Today, we have a very important guest with us. He's not a guest, he's a part of the Reliance Foundation Hospital. He's a consultant here, and his name is Dr. Rupin Shah. Dr. Rupin is an andrologist, and he has more than 35 years of experience in male infertility, male fertility, the genetics of the male, and he has trained more than 100 doctors in the art of treating men, particularly who have the unfortunate problem with infertility. Rupin has devised many instruments, operations, and he is one of the first in India to do what is called testicular sperm aspiration. With this, let us begin this podcast. Rupin, when I was much younger and I was walking one day on the street with my father, and this really happened, we saw a man coming out from what looked like a very expensive car. I don't even know the name. It may have been a BMW or something like that. And when the man came out, he was in a very wealthy kind of a suit, but they put him on a wheelchair. And I said, Dad, what has happened to this man? He was middle-aged. All my father said, and it didn't strike me at that time, health is wealth.
Good, sure.
And that has stayed with me all this while. So today's topic, how can we make a man or a couple healthy, even if they are not wealthy, or healthy when they are wealthy? Basically, what can we do to help a man who's struggling with infertility? Let us start with the first very important question. When a couple comes to you, do you insist that the man be there? Or is it that in your OPD, you only see men?
Well, Firuza, first of all, thank you for inviting me to be here. It's always a pleasure to chat with you. And this is a very important question. Where does the man fit in the equation of the couple trying for fertility? And sometimes I actually get upset because I find that the wife has undergone a whole bunch of investigations before the man is asked even to make an appearance and give a semen sample, only to then discover that the man is the cause of the couple's problem. So I think it's very important for both the couple and the doctor to realize that one of the first steps in the evaluation of an infertile couple should include the evaluation of the male, and in this case, starting with a semen examination.
About 20 years ago or so, I would see the poor lady come with tons of papers and files.
True.
In tow would be the mother-in-law or the mother, and the husband was always busy, could never make it. It was never the husband's fault. So many times, Rupin, I have not seen a single semen analysis where otherwise the wife has gone through laparoscopies, hysteroscopies, and it is a very unequal balance. But today, and I'm sure you will agree with me, that we do see most of the couples coming as a unit, and that is very heartening.
Sure.
How will you determine from your first visit that a man is so-called fertile or infertile? And even if he's fathered a child in the past, what are the things that you will emphasize on?
So I'll just take a step back and refer to what you said, that often the men never used to come. One of the male myths is that if I'm sexually potent, that means I'm fertile. So I think men, be very clear, sexual prowess and fertility are two very different things. A man could be sexually very potent and still have a 0 sperm count, and vice versa. So they're not linked. The male has to be evaluated. And as you asked, how do we know, does he have a problem? And this is important, the second part of your question, that even if they fathered a child once, it doesn't mean that he's normal. In fact, often we'll see couples where the man's sperm count was always low, but somehow the first pregnancy took place. And as I tell gynecologists in my lectures, often a clever woman compensates for a silly man Similarly, a fertile woman, a fertile young woman, could compensate for a male when she's young, but when they come for the second child, now the problem is fertility. So the male should be evaluated, whatever the situation. And the first step would be a semen sample which he can provide by masturbation, and which would tell us whether they're enough sperm, whether they're active sperm, whether they're healthy sperm. And this would be correlated with a medical history. So we know if there are any other factors at work, with a sexual history, so that we know that sex is happening frequently enough. And nowadays, this is often a real problem, especially in the larger cities where everyone is too busy working, traveling, and not getting enough time. And of course, it will be correlated with a basic physical examination, so that we know that there is no other structural problem that could be contributing to a problem. So this is simple, not invasive, very easy to do, and should be done.
So just to again go one step backwards, there are many couples who say, Doctor, first time it happened so easily. Now why is it difficult? So let's recount some of the steps. Well, when they had the first child, they were younger.
Very important.
They were having sex regularly.
Sure.
There was a kind of a magic and aura about the marriage, which unfortunately starts fading as everybody ages. There is less communication between the husband and wife. Many a times, whatever feelings the wife or the husband had gets repressed. So there's a psychological component too. Sure. I often tell couples who work together, I said, you are meeting more in the boardroom than in the bedroom. And it's a way of life now, Rupin. People, when they're working, perhaps they're on different shifts. Somebody is working morning shift, somebody is working USA time, somebody is working UK time. And this I see happening all the time. You take them aside, you take the husband aside and you take the wife aside and ask them in the privacy of a sacred consulting room, how many times do they actually have sex? Well, we always ask this question, and the first time they'll say, yeah, 2-3 times. Then you have to ask 2-3 times a month, 2-3 times in 6 months, or 2-3 times a year. Today, this is the reality. So that is why sometimes they are not conceiving because of this gap. And of course, there's always performance anxiety because they have to perform in the office, and that takes precedence over performing
at home.
At home.
Very true. In fact, this is again a very important point. Sexual dysfunction contributing to infertility. Widespread, common, and often hidden and not picked up. Even couples who are otherwise normal sexually, when they're told, now this is the fertile period, there is so much performance pressure, especially if the wife wakes up the husband at 4 a.m. I'm ovulating now, let's do it. The poor guy can't. So we'll see many couples now where they say, Doc, it's okay otherwise, but when I'm told this is the day, or I have to give a semen sample here and now, then they are unable to do it. And if that is a problem, tell your doctor, because there are simple solutions, simple, safe medications that can be given, which will help the erection, which will enable them to be together during the fertile period.
Can you elaborate a little bit more on what somebody who has performance anxiety or who has erectile dysfunction, how can they maneuver this blockage?
So one is, of course, I also tell the doctors that don't try and tell the couple you have to have you have to have sex at this time and these many times. But studies have shown that if couples in the fertile period have sex daily or alternate day or even every second, third day, it doesn't make much of a difference. So what we tell couples is have frequent sex, but don't time it either by an ovulation kit or by an ultrasound study. That will make it too mechanical and there'll be too much performance pressure. So that's the first piece of advice, that let it flow naturally. Let it still be pleasurable and not just a task that has to be accomplished. And if despite that there is a problem, medicines like Viagra or equivalent are very safe for couples who are trying to conceive. It will not harm the baby in any way. It will not impact the sperm or the partner, and it can be used.
Can you elaborate a little more on certain manual equipment that can help, like a vibrator?
Sure. So the other part of the sexual dysfunction, apart from erection, is the ability to ejaculate and give a sample. And many men will say, Doc, at home there's no problem, but in the clinic I can't give a sample. Or it's okay in the clinic, but during the fertile period I become too conscious, cannot give a sample. Or if we're told to have intercourse on those days, I just don't ejaculate. Again, common, and for this there are many solutions. Of course, a little bit of counseling will help, but we also have, as you said, devices like a penile vibrator, which is the penile equivalent of a body massager that gives a strong stimulus to the penis, thereby overcoming the inhibition, enabling the man to reach the adequate level of stimulation so that he can still ejaculate and give a sample. And we also have non-spermicidal condoms available. So some couples can ejaculate only by intercourse, not by masturbation. They can use these special condoms which do not kill sperm to collect a sample.
One piece of advice about lubricants, and one must be very careful because some of these lubricants which come, say, with, like, say, that comes like Durex or some other coconut oil sometimes is used. Some people I know even have used soap as a lubricant. These will definitely kill sperm. So be little aware of what is the good lubricant to use so that one can have a better erection and ejaculation. There's one brand which this is not a placement advertisement, but I use this. It's called Astroglide. It mimics the cervical mucus very well. And it gives a very good sense of lubrication both to the man and the woman, does not harm the sperm. We have actually done clinical studies in the lab, and we have seen that the sperm just glides through the Astroglide. It absolutely mimics the cervical mucus. So these are small things which can turn infertility to fertility. So there is a WHO manual called the 6th edition, which gives a lot of information of which semen sample is fertile and which is infertile. I would just want to emphasize that today we do not ask men to have abstinence. Even if you have ejaculated a day or two before, you don't need to have great abstinence to be able to give a semen sample. Lots of times, Rupin, you have couples coming from out of town and they're here just for 2 days and they have had intercourse or they have ejaculated the day before and they're so worried that if they give a sample, it may not come out correct. So what kind of advice would you give them?
No, we would look at the sample, whether it's a 1, 2, or 3 day abstinence. Studies have shown that it doesn't really matter too much. In fact, a very long abstinence will give the wrong results. Also, bear in mind that if a couple is trying for a child, we are telling them have sex every alternate day, which means that ideal abstinence should be 1 day or 2 days to really know what is the sample they are using when they're trying to have a child. So not a long abstinence, not too short an abstinence, and again it varies. Some people, if they do not have enough abstinence, they have difficulty ejaculating. Some men are better off with 2 or 3 days. So we recognize individual variation, but we are not too rigid about it.
I think that sounds reasonable for most couples. There is one very important test which has been introduced by us about 20 years ago, though, and it has actually caught on in the last 4-5 years. It's called the DNA fragmentation index. This is a very simple test, but it can be done in many complicated ways, many complicated assays. But there are some simple assays also which are commercially available. In this, what is done? The sperm head contains the DNA, which is a very vital thing for fertilization. And if there are excessive breaks in the DNA in the sperm head, then this indicates that there could be problems with fertilization, even in IVF, with miscarriages. And if there are double types of breaks, then this causes more damage and less fertility. There are many papers that have shown the vitality of the sperm DNA. In fact, we have also published on this. Do you insist on a DNA fragmentation index?
So again, this was a very important point which you brought out, because there are many studies showing that even men whose conventional semen parameters, which means count, motility, shape, are normal, may still have very high DNA fragmentation, and that would be the cause of either failure to conceive or recurrent pregnancy loss. So, DNA fragmentation is one of the important steps that we use to assess male fertility beyond the basic.
Right. We had carried out a study many years ago where we showed that men who are older tend to have more DNA fragmentation and diabetic men tend to have more DNA fragmentation. Therefore, lifestyle correction, Rupin, I think, is very important to emphasize for males and couples coming forward, both for the male and the woman. So, can you give us a little breakdown of what advice you will give to couples who come and ask you, doctor, what can I do to change my sperm count or to get pregnant faster? What are the simple steps that you can guide me on?
Again, a very important question. Every once in a while, a man will come to my clinic on a second visit and his sperm count is much, much better. I ask him, what did you do? No, doc, I followed your advice, which only a few people do. And the advice is, of course, exercise regularly, but no sauna or steam because heat is bad. More of vegetables, salads, which give antioxidants, avoiding sugar, sugary drinks, synthetic drinks, if possible, going organic, and adequate sleep, exercising to lose weight and to keep fit. There was a very interesting study which I'd share where they took monogenic rats, which means all the rats were the same, divided them into two groups. One group, these are all male rats. One group was fed food that made them big and fat and diabetic, and the other rats were kept healthy. Then they were allowed to mate, and the offspring were examined. And the offspring of the obese rats were more likely to be diabetic and obese, and the offspring of the healthy fathers were healthier. So we know that the health of the woman at the time of conception has a great impact on the baby. But what this study showed was even the health of the father when he gives the sperm that makes the baby through epigenetic modifications can actually impact the health of the child. So often I tell men that the greatest gift you can give your yet to be born child is to be at your healthiest best at the time of conception. It'll improve the sperm quality, making it easier to get pregnant, and it'll contribute to a healthier future for your child. So take lifestyle changes very seriously. And we are bombarded by chemicals from everywhere: plastics, synthetics, endocrine disruptors, pesticides. And the healthier we can be in terms of what we eat, drink, and how we live our life could make a big impact on the sperm, on fertility, and the baby.
I'd like to share with you all our experience during COVID. There were women who were struggling to get pregnant, and there were men who had very low counts. And I'm sure you observed this phenomenon too. During COVID, we saw a spate of natural conception.
Sure.
So I think it might have to do with having more time with one another, not being distracted by outside, less exposure to petrols, to chemicals.
Pollution
Went down. We actually saw peacocks on the Kem's Corner flyover. We saw whales on the beaches. So all COVID was a big lesson for us. And we also published during that time. We showed that, of course, the virus had a lot of effect on the proteomics of the semen, and we published it in collaboration with IIT. But what we also noticed that was the best time for couples to get together. It was a wonderful time, not for everybody. It was hard times for many. But as far as fertility was concerned, many got pregnant.
Sure.
Naturally. That just goes to say, sure, that if you are in a happy relationship, if you spend time with your partner, no matter how low your sperm, there's always a chance that one sperm will catch the egg.
And the environment, a happier, less polluted environment will play its role.
Yes. Rupin, diabetes, India has now become the hub for diabetes. And men are getting diabetes one decade earlier So, and we have seen, and I'm sure you have seen a lot, that diabetic men have erectile dysfunction, libido is less, they cannot sustain the erection, and of course, the sperm count suffer. So, if there's one message you want to give to diabetic men, what would it be?
Oh, the message I give all diabetic men is make sure your sugar control is excellent. And I tell them it's going to help your erection, it's going to help your sperm, but even more so, diabetes has many other complications. It can affect your vision, it can affect your kidneys, it can lead to neuropathy and severe burning in the feet because a lot of men come to me, sugar not controlled. How long have you had diabetes? 5 years, 10 years. By now, you should have perfect control. You should understand this disease because it's going to be your companion forever. So I spent quite some time telling them the truth, but also scaring them that for your sperm, for your sex, but for your entire life's health, make sure that your sugar control is excellent. And that is the diet, it is the exercise, it is the monitoring, all of it, very important.
Once I had a couple, I think he was a minister somewhere, I don't remember, and they came into my office very pompously and wanted to start IVF in the very next cycle. The man was grossly diabetic. His HbA1c was something like 11. And when I told him that, look, you have to wait, your fertilization will be poor, the outcome will be poor, he just stormed out of my office. I have a IVF doctor next door who is ready to do it for me. So my advice would be that always keep the patient's interest in mind. If you feel the patient or couple is not ready, it's better to wait, get them in good health, and then proceed, because that way you are really creating healthy babies.
Which is very important. I read a study which is actually in your area that if obese women lose just 5% of their weight, the chances of pregnancy increase significantly.
Truly, true. That's very true. You know, today we are lucky, and infertile men are lucky because even if the sperm count is zero, what we call azoospermia, cryptozoospermia, even if they have uh, certain morphological changes like immotile senior syndrome, globozoospermia, they can still father their own biological children.
Thanks to you and your lab,
Thank
where you can take one sperm, put it in that one egg, and create a wonderful baby.
But Rupin, on the flip side, men with azoospermia, you know, there are studies which show that where there is a very low sperm count or no sperm count, there's a higher risk of cancer. People with cryptorchid testes can develop cancer later on, testicular. They've also shown that the first degree relatives of such men at a higher risk for morbid conditions. Can you throw a little light on the genetics of this?
So there have been many interesting studies. One, we know that, as you said, an undescended testes, which leads to infertility, can also have a significantly greater risk of malignancy. But what has been very interesting is studies showing that infertility in men is a marker for poorer health overall and perhaps even a shorter lifespan. Now, we don't want to scare the listeners. Everybody shouldn't think I'm infertile, so I'm going to get cancer. No, the majority will not. It's just an increased risk factor. So the take home message is that if you have infertility, make sure that you're medically completely evaluated.
I think that's very reasonable and sound advice. Men who have this problem should definitely look into the general health, because that is going to pay dividends in the future. I think we have given a lot of hope, a lot of good information, and we are here to guide you on your path to parenthood. Don't be afraid. We will guide you to the right steps. Thank you very much, Rupin.
Thank you, Firuza. It was a pleasure as always. Maybe next time we'll talk about men who have zero sperm count and the modern miracles that can still happen.
Thank you, everybody.